follow-up question to that. In this, how can, and don't mind me, Wendy, with you here, how can the U.S. government or other donors help foster better communication amongst the partners? Is there a role that governments can play in helping to connect everybody and
Okay, I'm not sure that I can answer this because I'm not in the U.S. government, but I will say that already USAID is one of the partners in one of these organizations that we've been talking about, and they have really helped to bring the partners together and have really been a leader in terms of trying to move this issue forward, and have also spoken to us very specifically about, wow, here's a role, J&J, that you can play, and here's the role that we're going to play, and those will, they'll be aligned and we'll be able to have impact measures together. So they already have done a lot. I feel like the government has an expertise in convening and moving issues forward, so they should be able to, certainly they should be able to help us with this issue. I did want to clarify also, it's usually with these big groups, it's the collaboratives, it's, with individual organizations, the process usually runs quite smoothly, although year one is always tough. The big collaboratives is the issue. But I do feel that there is a role for government and government organizations, and I'm just not sure how that would work. Do you have suggestions?
I think it's an interesting issue to try to think through, and with any kind of partnership where you have multiple parties, the more people you have at the table, the more complicated it will get, and trying to get alignment with all the different parties and meet all of their different needs. Which sometimes might be competing, and certainly if you have a partnership where all the partners at the table independently need to seek funding to get their piece of the partnership to continue to move forward, I can see where that might raise some real challenges. So I think it's for those partnerships where the U.S. government is one of the partners at the table. We certainly should be playing an active role in thinking about how to manage those communication issues and make sure that the partnership is functioning effectively. And I know that a lot of work has gone on. There's a lot of work going on in terms of really understanding what makes these partnerships work. How can we do things better? And that sort of continued process of learning is actively going on. But we welcome thoughts broadly and then specifically on where we can continue to make these effective, because we believe that they're such a key part of our development agenda. So we've got to make sure they're working as well as they can.
Yes. When Wendy was speaking, she mentioned the need to determine what is in there for each partner. And I just wanted to have your thoughts about products that get to countries, and you have this issue of either give them out free or at subsidized rates. And you find out that that compromises some of the private sector enterprises at country level. The second aspect of the challenge is governments coming in and determining whether or not to reduce taxes and tariffs on some of these products. These are two challenges, especially in Africa, that have tended to undermine public-private partnerships for access and utilization of public goods. What are your thoughts on how to improve on this, especially coming from the malaria sector?
I'll try to give a malaria example. Let me take the first one, and it's a really important issue. And if you're thinking about product development and bringing industry to the table to develop a product where there hasn't been a viable market, and you're asking them to go through all of the costs of of research and development, and then they actually need to manufacture those products and get them into the marketplace. There has to be, you're either, as a donor, you're going to come in and you're going to subsidize the whole thing, or you need to be able to find ways for industry to be able to either have some kind of return, or in some cases they might be willing to do things at cost, or in some cases it will be just completely subsidized by the public sector, or they might be willing to be able to donate in some places because they can make up for, they can sell those products in other markets, and the margins they get there can allow them to donate. So I think those kinds of things need to be thought through at the outset, and industry needs to understand what's going to happen on the back end. We can't simply expect them to come to the table and we'll work these things out later. I think it needs to be thought through all the way through the process. In terms of taxes and tariffs, I think it's a really important issue. I heard a fair amount about that in the case of malaria. When you're thinking about getting bed nets into the marketplace, if we end up with some of these products that get stuck at the ports because the taxes and tariffs can create real barriers, then that impedes access. So it's an important issue to continue to work through and make sure that we don't have additional kind of roadblocks along the way of our distribution channels. So please let's start on those.
Yes, sorry, Wendy. I'm really raising this issue because recently we had a training in Lusaka on helping babies breathe, and we could not get in the neonatally until the day of the training because the government insisted on paying tax.
I'm sorry, the government
insisted on paying tax on the neonatally, and they are not for sale. They're not for profit.
So they were insisting on taxes for products that were not even for sale.
That's right. So I just see a role for U.S. government, for big agencies to help pave the way for these products because they need to get to where they are needed in order to make the impact.
I agree with you. It's a very important issue. I know there are some groups that have been taking a deep dive and really trying to look at this issue and get a better understanding of it and think through ways around it. But this is an important area where diplomacy and development come together and needs to continue to push forward on some new solutions here.
Does anyone want to comment on that?
So we had that same problem with the baby Annie and actually had to pay the tax. So it does happen. I know that with our program Children Without Worms, which is going from 50 million doses to 200 million doses, the doses are donated, and they're produced for no other reason to give. They're not sold by J&J. And the director who works on that program, and I have to recognize Conrad Person, who's with J&J, who came in a little late, and he has worked for many years on that program as well, has had to work directly with the governments often. And things have gotten stuck in customs, things have disappeared. Never to be found again, but it is a huge, huge issue. I will say that in terms of sustaining it and who gets something for free and who doesn't get something for free, we are creating a business model for mHealth, so similar to Text for Baby, but expanding it to 7 other countries, that some countries will receive mHealth, the mHealth messages for the mobile phones for free. Others will begin to receive it for free and opt in for a small charge if they want, for instance, messages beyond pregnancy into the baby's toddlerhood. They opt in for a small fee to continue those text messages, but every cent goes right back in to supporting the countries that cannot afford it but need it. So there is no, it is a not-for-profit model.
Other questions? Over here and then to the back.
Wendy, since you're in charge of launching the GHI,
Not just me, there's a lot.
I guess since you're on the inside and since you started doing this, is there anything that you would change about it?
Yeah, I'm trying to plead the fifth since I've only been there 2 months. No, I mean, I think, as with, what I can say is, with any new initiative, I mean, this is a big effort. We're trying to change the way we do business, and there's going to be learning along the way. And I think when we get through this, at the end, we'll be able to look back and think of a range of different things that we could have done differently. And as we go forward, as we see where we need to be 6 months from now, where we need to be 12 months from now, we need to continue to assess not just where we're going, but are there things that we could be doing better? And I think I'll kind of leave it at that. But it's it's a pretty big undertaking in terms of taking this whole of government approach. And I think we recognize this is hard. But it needs to be done, and so we're going to continue to push through the hard issues and continue to find ways to be able to work very well together to coordinate these efforts. And in talking about having a partnership with multiple players at the table, GHI is a partnership in the U.S. government with multiple players at the table, and we need to work through a lot of issues where we have those shared goals and each have a stake in the game, and I think it's a real challenge, but I think one where all of us, where we all recognize that this is something that we need to do and kind of slog through the hard stuff so we can get to the good impact down the road.
I was struck by the cooperative tone here today, which led me to wonder, is the advocacy community involved in these partnerships, and what is the tone of that